How's it going, everybody? I'm Dr. John Clayton, your Layton chiropractor here in Utah at Supra Chiropractic. In today's video, we'll be addressing the question of what motion that you do on a daily basis is causing your hip pain, back pain, and potentially even sciatica. So stay tuned in this video as we go through and answer this question, and I hope you guys enjoy. So tell me more about what you have going on in your back.
I have had pain for about 2 weeks in my hip is what I thought it was. It initially felt like it was like radiating around my glute and my hip, and it's just like this like weird, like kind of dull, numb pain. And then it started to hurt even worse in my lower back. And when I walk around, I can feel like numbness in my leg and in my foot. So it kind of starts at my lower back and radiates all the way down.
Perfect. So take a seat from me for just a sec there. So just to better understand it, when you have the pain, when you say your hip, is it more hip here or more hip in the back area?
In the back.
Okay. So pain in the hip here, and then when you, so a lot of questions too that I'll ask people is, so if pain starts back in here, okay, does it radiate down the glute and kind of go down like this into your hamstring, or does it go more the side of the leg or the front of the leg?
It starts kind of here, and then it's like going numb now. It goes around like this, and then I kind of feel it go down the side and go numb to my foot, if that makes sense. Not the back. I don't really feel it in the back, but like the side kind of, it goes numb. The side
more. Okay. Yeah, and so a good way to tell just from this, because a lot of times if someone says it's going down to my foot, automatically any doctor is going to think it's a disc herniation, disc bulge, stuff like that, right? And so the best way I've found is for one, asking questions, right? And so if I know that the pain is coming from more of the glute area and then going down more of the hamstring, which is typically going to be the sciatic nerve, and unless it's going to one specific area of your foot, that's how we rule out if it's a disc injury or whatnot, right? But some other tests you can do too. So if someone has this injury and they're like, hey, how do I diagnose it at home? A good way to test it is, okay, we want to compress the discs in general, and see. So if you look straight ahead for me, what I'm going to do is actually go on the top of your head here and push straight down. Okay. Does that make the pain in your lower back and hip worse?
No, I don't think so.
Okay. Yeah. So then across your arms, across your chest for me, kind of give yourself a big hug. So if I just hold the top of your shoulders here, if I twist like this, then if I push down at an angle here.
Yeah.
Okay, you feel that?
Yeah.
Okay. And then here, push like that. Okay.
Okay.
So then you're like, okay, you maybe feel more there.
I felt it more that way.
Yep.
A little bit less this way, but still felt it. And then I didn't really feel it at all when you pushed me down without crossing my arms.
Okay. So what I'm testing for there is these joints right here that are close to the nerve that comes out of your spine. But even just compressing like that, we ruled out disc for the most part, right? I mean, obviously your best way to diagnose it is MRI, right?
Yeah.
But there can be inflammation in this joint right here of the spine that can cause similar things, but in that turning position and pushing down too, it'll also load the hip joint, which is right here. Okay. And so a lot of times, yes, we need to adjust all these different areas, but we need to rule in or rule out if it's safe to do so, which usually at this point it's like, hey, if you dealt it for 2 weeks, it's safe to adjust because you're not in the hospital. It's not going to get any worse.
Yeah, it's not getting worse, yeah.
So, perfect. So now what we're going to do is we'll go through and adjust everything, and then I'll kind of show just when you're face down how it all wraps around and kind of how the sciatic nerve goes into it, and then we'll adjust from there.
Okay, sounds good. I do have like a leotard, like onesie on, but I have like a sports bra under. Should I just like roll that down, or are you okay with just this?
I can just work on that right now. Yeah, you're good.
I'm gonna lay down.
Yeah, yeah, perfect. Yeah, a lot of times too, people are kind of cold, and so I'm like, during this time of year, it's like just keep whatever layers on.
I know. I like to be as warm as possible.
So I don't blame you.
Yeah.
Okay.
It just snowed so much yesterday.
Yeah, no worries. And then your arm, there's some pads right here if you'd like to put your arms there.
Perfect.
Okay. So now we're going to go through and show. So with the hip joints right here, the SI joints, sacroiliac joints. Okay. This is just for the people that like all the information. So SI joints right here, basically L4, L3, L5, all these ones right here in the spine. the nerves will go out of there and then become part of the sciatic nerve. But if one of these is pinched, you'll feel it down to where that nerve controls. Okay? And so a good example is like, hey, I only feel pain or the numbness in my big toe. Okay, but not the rest of the foot, just the big toe. It's like, okay, perfect. Whatever nerve goes to the big toe, so L5, right? Or right, you just literally, you can look at a chart and you could self-diagnose it from that angle, right? But if most of the time your pain is going, I call it the candy cane. So if it goes from here, kind of loops down and goes right here, down to about here, and it's worse in that vicinity from here to here. You're dealing usually with sciatica. You'll get a little bit down into here, and then sometimes numbness in the foot. But if you can't isolate which area of the foot it's coming from, we just assume most likely it's going to be that whole entire nerve bundle here, and that's just kind of a referral from going down into here. Okay, so does that all make sense then?
Yeah, that all makes sense, and I know exactly where I feel the numbness.
Okay, where do you feel it mostly?
I feel it in the center of my foot.
Okay.
Like right there.
Perfect.
Okay.
So then if we can test a few things too. If it's mostly in the foot pad area, we want to rule out maybe your sacral nerves as well. Okay. So we did spinal right here. Okay. So if I push, so top of your hips here, the SI joints, go down a little bit there, because between the middle there is going to be L5. If I push on your sacrum right here, it's a triangle bone. We're going to push on the left side there. If you feel that numbness in your foot, in the middle of your foot on the bottom, get worse, let me know. Okay. So if you push here, so that'd be S1, S2, S3, S4. Any of those?
S3, S4, yeah, started to feel numb.
Okay. Perfect. So then if we feel through there, if I push on the muscle now, do you feel it? That goes
numb too, yeah. Okay. It's mostly, I feel it in the center and on the side right here a little bit. But mostly just kind of like right there. It's weird.
Okay. And if we find your hip bone here on the side and we just go straight in from that here, same thing?
Oh yeah.
Okay.
Still in the same spot.
Okay. So once we adjust everything, do all the dry needling, then we can always recheck it and see. Okay. But for the most part, that should clear up when we do all the dry needling through there.
Awesome.
Okay. So a big one here as well, if there's no major trauma to the sacrum, for the most part, it wouldn't have an issue on one side. And so you can kind of use stuff like that where it's like, okay, unless you have some disorder or something crazy going on, it would usually rarely affect one side, but injury would be your telltale sign of it going and being an actual issue in the bone right here, because it's a huge bone and basically everything's fused together. And so to have it isolate only one area, very rare, could happen, but still very rare.
Does that mean that I probably have like some sort of injury then to it?
Most likely not, right? Because you would have been like, hey, I fell down the stairs, hey, I did this, because you don't have anything that you can relate it to, like a car accident, and like a common one for like this area is falling down the stairs. Like you slip and then your butt hits the stair and you go da-da-da-da like that. Yeah. That's going to be your most common way of injuring that. Okay. So we'll go through and adjust these areas here. So just to kind of reiterate, because you've had the 2 car accidents in like the last like 7 years, right? So with that, yes, there could be some residual from that because we didn't see you during that time. Then we don't really know. But keep in the back of our minds, if you keep having this issue and it repeats, or increases in how often it's happening, a good idea would be to go get an MRI of this area, right?
But there's no risk or anything?
No. No, I mean, very little, right? Yes, there's risk to everything. However, with this area here, because it just came on like 2 weeks ago, but you didn't have it prior, and it just kind of is hit or miss, then no, right? If you had this all the time, then I'd be like, yeah, let's not touch you, and let's, go to the hospital, do an MRI, stuff like that, right? So usually based on history as well, and that's why we asked you about that as well, is when did it start happening recently? 2 weeks ago, perfect, no problem. And then kind of to answer the question further of, let's say we go in here and do all this stuff on you, we dry needle, we adjust, and it literally doesn't help at all, then boom, you're in for an MRI. Okay. So great question, and that's usually what I tell people is like, if you see little to no improvement from what I'm doing, then that usually tells me that we need to evaluate deeper, like an MRI.
Okay.
So I'm going to run through rib cage on you first. Okay. Rib cage over here, spine, and then kind of up in here. Is there any areas you don't want adjusted, like your neck or anything? Are you okay with that?
Neck is actually okay, so I don't think that.
Okay, so don't touch the neck.
Yeah, I'm
okay,
with
no
that
problem.
neck, but everything else is fine.
No problem. Okay, let it relax. Breathe out.
Oh gosh. Sorry about my noises.
Oh, you're fine. See, people got to know that you're alive, so if you make noises, they know you're alive. That's good. Just gonna move your head down just a smidge there. Do the same thing on the other side. Okay. Deep breath in, all the way out. See, that's where you're holding all your stress, huh?
I think so.
Gotcha. Okay, so this lower back here, so I'm going to go kind of into kind of a lower spot that kind of feels awkward to push straight down into, but in the end, we got to get it to release, okay? Okay, deep breath in, all the way out, let it go. Let it go. Then these ones will feel a little bit more normal because they're kind of where the ribs are, okay? Deep breath in here, all the way out, let it go. Deep breath in here, all the way out. Deep breath in here, all the way out. Deep breath in here. And then I'm going to kind of do this neck shoulder area here. So it's not, we're not doing your neck, but sometimes it feels like we are because we're kind of moving your neck to the side like that. Okay. Deep breath in, all the way out, let it go.
Oh, just let that pop.
So that was a good one there.
That was a good one.
Deep breath in here, all the way out, let it go.
Okay.
Okay.
Perfect.
And then any tenderness in front of the shoulders here.
No.
Okay. Here's your favorite one now. Now we're gonna do low back. Okay. So I'm gonna do the not as bad side first. Okay. So lay on your left side for me.
Okay. On this side?
Yep. And then just bring that arm. Yep. Perfect. Just like that. So I'm just gonna grab this arm here. Bring this shoulder out a little bit here. Okay. If you're pushing into that headpiece with your shoulder, you can slide down just a little bit. Okay. So come down towards your feet. There you go.
Okay.
Yes,
Am I okay with my hip being this way?
Yeah, I'll kind of position it. So we're gonna just tuck that foot back in the knee there. I'm gonna slide it towards me just a bit. I got you. Okay, I'm gonna be pushing pressure towards like me like that. Okay, let's deep breath in, all the way out. Let it go. Good, just like that. A little bit tight,
I
right?
felt it though. That was good.
Yep. Now lay on your other side.
Okay. Oh gosh.
Okay. Here's the fun one. Okay. So this one here. Okay. I'm gonna bring this arm down right there. Okay. And then we're just gonna hold that top shoulder there. Okay, so what I need to do is bring this leg up like this, and we're gonna get contraction down like that. Okay. Deep breath in. All the way out. Let it go. Let it go. Let it go. Just like that. Not too bad, right?
Not too bad.
Okay. And any tenderness still here in the sacrum?
No, not worse.
Not too bad.
Yeah, it's.
Okay, so it's mostly going to come from that glute right there then. See how tight that is in this position? Okay.
Yeah, that's super tight right there.
So now lay on your back for me. Okay. So now we're going to set the actual hip joint here, because so where the SI joint is in the middle there, and then out here is the span of where the glute muscle is. Okay, so we're going to loosen this joint. We just did the other joint, so we're going to get where the muscles actually hook into release. Okay, so we're going to go here up to the side, let it go for me there. Okay, just a little pull. I didn't prep you very good. So.
No, it's okay.
Yeah.
I did have a knee injury a few years back on this side. So,
Okay.
It's my ACL tore. I had to get reconstructive surgery. I don't know if that's pertinent to.
Yeah, no worries. So with this too, ACL is going to prevent your knee from going that direction, like downwards. So what I do if I know you have an ACL reconstruction, I just hold your leg like this, and I can still pull like that. Okay, so let it relax here, just like that.
Okay, perfect. Awesome. I just have so many problems.
Yeah, no, you're good. We all do. We just hide them really well, right?
Yeah.
Okay. So now we're going to do your ankles real quick. Good old AI. Okay. So now we're going to do ankles. So we're going to hit this one here. Get right into there for me here. Ooh, we're going to pull a little bit harder. You okay? You got it?
Got it, yeah.
You got it. Let it go there. Let it go. Let it go. There it is. There it is.
Oh my gosh.
Crazy, huh?
Crazy.
All right.
Okay.
Still connected. Don't worry. Don't
Yeah.
worry. Doesn't feel like it for a second though.
Yeah, okay.
Okay. You good?
Yeah, I'm good.
Okay. Now we're going to go through the middle of your foot. Okay. So we're going to rule out and make sure that it isn't plantar fasciitis as well.
Okay.
So if we roll here, let it go like that. Let it drop in. Okay. A little bit tender. Okay.
Okay.
Probably not a fan of having your toes popped.
No.
Okay. We'll leave those alone. We'll leave those alone. Okay.
Thank
So we're going to
you.
do the same thing on this ankle here. Okay. So I got to kind of pull it up like this. Let it go. Let it go. You're going to feel a big strong pull.
Okay.
Just like
First
that.
time. Okay.
We got it. Okay, this one we're just gonna drop it in like this.
Okay.
Let it go. Not too bad. Okay.
Yeah, that side was good.
Yeah.
I didn't
That's how-
rate it as much.
So you probably rolled that guy a few times.
Oh yeah,
So.
cheer, dance, all the things.
Yeah. Okay. And then, do you want me to check anything with your arms? Do you have any problems with your arms, hands? No problems.
Oh, yeah.
Okay. And then a lot of people, if they don't like the neck twisted to side like that, then I'll at least just kind of pull up on it and kind of give you some decompression on it. Most people are like, that feels great. Don't do the side to side stuff. Okay. You good if I do that?
Yeah.
I'll just kind of show you at first. Okay.
Yeah. I'll take my haircut out too. Make it easier.
No problem. Okay. So all I would do is just kind of hold it here at the base like this, lift up like this, and then just kind of pull like that.
Okay. I feel good about that.
Deep breath in, all the way out, let it go. Just like that.
Okay.
Not too bad, right?
No.
Okay. So we're just gonna run through this top portion here. So we're just gonna find the hip bone here. We're gonna move just slightly out to the side and go a little bit past halfway, figure out where the top of the hip is, and we go in right here.
Okay.
And we just go straight in. Okay, you're gonna feel a little bit of pressure, okay? Okay, and there's your hip bone.
Perfect.
Feel that? Perfect. Okay, and then one more out to the side, two more on the lower side there. Okay, so we go hip bone here, kind of in between the needle we just put in, about halfway across, and like that.
Pressure for sure.
That one always feels like a ton of pressure.
Yeah.
Okay, then this one's going to go in from the side, so we're going to find your hip bone here. We're going to go right above that, about 2 inches above. Okay, this one isn't super bad until it goes pretty far in, okay?
Okay.
So you have to go through your gluteus maximus and then into the piriformis muscle, which is usually what's grabbing onto the sciatic nerve. Okay?
Yeah.
And one more on this side. It's going to be slightly lower right here. Okay, I'm going to go right there. Just like that. Oh, you're good. Good job. Okay, so that's everything we need for that side, okay?
Cool. Okay.
Perfect. So then basically we do the same thing on the other side. So we'll show it what it looks like when they're all hooked up and going from there, okay? All right, so we have the glutes needled here. We have the gluteus medius, gluteus maximus here, needled on the left side where the complaint area is mostly. Then the lower needles are in the gluteus maximus and piriformis muscles. And the same thing is needled on both sides. So we can see that there is a contraction going. We're going to mainly focus on this left side here. So we have that contraction going through the top glute and then down to the glute down here. And like the patient indicated, that they do feel pain or a numbness in their foot. So if you look and we zoom out here, that left foot is twitching. So we'll kind of show you from here. The foot is twitching and it's all the way from the needle up in the glute. And so whenever someone has a sciatic distribution of symptoms, they can go all the way down to the foot, but they typically only go to the back of the knee. And so that is our dry needling for sciatica and how we get rid of sciatica. All right, so the moment that you have all been waiting for is that the answer to this question of what are you doing on a daily basis is causing the pain that you're having in your lower back, hips, as well as potential for sciatica. And so the answer to this question is crossing your legs. So if you didn't catch that from the video, the simple answer is the more you cross even your ankles, your legs when you're sitting over each other, or even when you're sleeping, that is actually causing your lower back to get worse and tighter because it's tightening your glute muscles, which then hook into your hips, into your pelvis, and there is your answer. So a lot of times you don't really realize that this is the problem until it is too late or the sciatica has set in. And so if this is happening to you or to a loved one, then send them my way here at Supra Chiropractic so we can fix them up. We can help them like you saw this patient here in the video where we go in, we adjust everything, but then we do the dry needling and it's a pretty instant fix. And so my track record has been pretty good as far as getting patients out of sciatica, and it's basically usually one visit, or if there's something else going on, we figure that out. That's usually not sciatica at that point. It's something other, outside that we need to refer for. And so in the end, we either use this as a tool to fix the problem or to diagnose a difficult or more serious issue that doesn't fall into the chiropractic realm. And so either way, we help the patients. And so that is the goal for what I do and how I do it. And it's not like anyone else that does it this way either. So it's kind of a cool thing and a rare thing. But if you are someone that's suffering with sciatica or some lower back pain that just isn't getting better, that's when you come in and see me, and then we figure out what's going on, fix the issue, or if we can't fix it as chiropractors, if it's not in our scope of practice or something that we can actually fix, then I personally will refer you out to someone who can fix the issue once we've diagnosed what that problem is. So hope you guys enjoy these videos, and just like always, we're going to leave you like we leave you in every other video. We're at Supra Chiropractic. We've got your back and everything else. See you in the next video.